When somebody's depressed, they generally feel pretty hopeless and pretty helpless. And as depression gets more and more severe, the probability that you need medication goes up and up and up. It's my belief that the only time that a drug should be used in anybody's situation is when it has been clearly shown to be the only thing that's going to work well. So, if your mood's not great, you should consider what are the other possibilities. Are you sleeping well? Are you sleeping in a good pattern? In other words, if you go to bed before midnight, that sleep that you get is equivalent to 4 hours of sleep for every hour after midnight per hour. So, if you go to bed at 10, and you fall asleep around 10, those 2 hours before midnight count for a full 8 hours after midnight in terms of the benefit to mood. There are other things you can do to support excellent sleep. Melatonin instead of a sleep medication. 1 to 3 milligrams of melatonin, tablets or sublinguals, which I like, they melt under the tongue. Great choice. You can take 1, 3, 6, or 9 milligrams of melatonin and get a great induction of sleep. In other words, it helps you go to sleep. Maintenance of sleep, which helps your sleep stay, and then quality of sleep, where you actually get a nice deep sleep, which restores your neurotransmission, so those messages in your brain that are supposed to be sent properly are. So a great place to start, of course, check with your doc, because your doctor and your natural choices are better together.